Getting the next presentation up, I would like to now, it is my honor to introduce another powerhouse researcher, someone who usually works behind the scenes and whose impact is impossible to miss. Dr. M.J. Milloy, where are you? You're hiding somewhere? Come on down. Here he is. He's a brilliant epidemiologist, a research scientist at the BC Centre of Substance Use and UBC's first ever Canopy Growth Professor of Cannabis Science. I got to hear more about that. He leads critical research in Vancouver's downtown east side. That's a lot of work. He's investigating how cannabis can support people who are most at risk for overdose. MJ has been a relentless advocate for change, combining heart, science, and action with over 350 peer-reviewed publications. How the heck do you have time to do that? You cloned yourself, okay. He brings a rare depth of expertise, and he has a great sense of humor too. And he's part of our Maverick team, which you'll hear about in a little bit. But we're just so lucky to have him. He drove up here, and we're just, yeah, thank you. Please join me in welcoming Dr. M.J. Milloy.
Thank you very much. And I'm a little taller. Perfect, thank you. Thank you, Michael, for this fantastic event. Not only this. And thank you, Dr. Fair, for the wonderful and partially accurate introduction. I will do my best to try and live up to those kind words. It's a real pleasure to be here today, not only because it was a great drive and it's a wonderful place to spend some time, but just to be among folks who are so compassionate, who are attacking this problem with an open heart and trying to leave a light on. And I think in these times, that sort of hope and that sort of action is something we all need to get behind. So I'm very thrilled to be here and to try and share what we've been learning in Vancouver at the BC Centre on Substance Use, where I work, and what we've been learning from the folks who are living and dying through this overdose crisis. And it's a tremendous honor and privilege to be able to bring those stories to you in the hopes that we might learn from them and we might chart a better path forward for all of us. So let me get right to things, because Michael has threatened me with physical violence if I don't stick to 20 minutes. So I will get on to it. But before I do, I want to share with you my disclosures. It's funny, I'm a much more mediocre researcher than Dr. Walsh, and yet I have a lot more disclosures. I'm really not sure why that is. Long story short, the research I'm going to show to you today has been produced with funding from the U.S. federal government through the National Institute on Drug Abuse. And the job that I hold, the Canopy Growth Professorship, which is a very strange thing to have, was established through gifts to the university from Canopy Growth and the Ministry of Mental Health and Addictions, with a mandate to investigate this idea. What role cannabis might play in the overdose crisis. But rest assured, like Zach, those folks do not tell me what to do or how to research or what the conclusions I draw. And like all UBC faculty, I have a responsibility to conduct ethical research in the public interest, and that's what I'm trying to do. If you look closely, you'll see that I've been produced, in a sense, by Donald Trump and the world's largest producer of legal weed, which certainly 16-year-old MJ would never have believed or really understood. So here we are. Before I go any further, though, I want to also really acknowledge that the work I do is on the unceded traditional and ancestral territories of the Coast Salish, and I'm very grateful to them and to all Indigenous groups across Turtle Island for their stewardship of these lands since time immemorial. Right, get down to it. The drug overdose crisis. It is, by any definition, a unprecedented, tragic, uncontrolled, ongoing public health catastrophe. We have lost far too many of our fellow citizens, our friends, our neighbors, our loved ones, to a completely preventable cause. I read the other day that drug overdose is now the leading cause of death for people aged 10 to 19 in this province. And that should shame all of us involved in the response to this crisis, from Mr. Eby on down, hell, from Mr. Carney on down. And so, starting off, I want to challenge us to think about the crisis a little bit differently. Not as a crisis caused by fentanyl and people who use drugs, although that is the proximate cause. But as Zach sort of hinted, let's think of this crisis as what has been produced by failure. The failure of the war on drugs, the failure often of our healthcare systems, despite lots of good effort to provide care for folks living with addictions and pain and trauma and all of the symptoms of life. And also, of course, in a time of abundance, so many of our neighbors are living without good jobs, without decent homes. And what you get through all of those failures is the overdose crisis. We're lucky here in BC in the sense that in 2016, of course, the provincial government declared a public health emergency and has subsequently done some good work scaling up some evidence-based approaches to address that crisis. However, we've lost 16,000 folks since the beginning of the crisis, and it is a crisis that spans all corners of the province. Unfortunately, these are the numbers for Kamloops. These are the rates compared to BC, and so you'll see that there are higher rates generally here in Kamloops of death from overdose than in the rest of BC. I'm very aware that, out there in the audience, you'll probably see friends and neighbors and loved ones in that orange line. And I think that's a shame and a tragedy. And so I'm going to dedicate my talk to those folks that we've lost from here in Kamloops. I'm an epidemiologist, and so the way I work is not thinking about sort of individual deaths, because they're all unique and they're all tragic, but rather thinking about deaths on a population level. And what can we learn from these overdose deaths to understand why they happened, and more importantly, to figure out ways to prevent similar deaths in the future. And over about 20 or 30 years of research, scientists like myself have come up with some risk factors that we know, with everything else being equal, really increase the risk of death for folks from a fatal overdose. And some of it's behaviors. If you use fentanyl, if you use it alone, if you use it in public, that's a big risk for death. If you are living with a substance use disorder, that's often another risk factor for this. But oftentimes, it often is circumstances. If you're leaving a correctional facility, if you're disengaging from treatment, these are also periods when the risk of death is much higher. Now, as I said, we're lucky here in BC that the government has done some good work in bringing the sorts of evidence-based approaches to prevent these deaths from happening. This was a study I did with Bonnie Henry, which is crazy, back in 2018 or so. And we tried to estimate how many of these evidence-based approaches averted deaths. How many deaths were averted in the early days of the crisis? Methadone, overdose prevention sites, and distributing naloxone. These are all really good ways of preventing deaths at a population level. I'm going to try and use this laser thing, so careful. Is it working? No, I'm just an old man and I'm totally incapable. Oh, there we go. Yeah. So these are the deaths here that were averted. But what I want to talk about today is the deaths that happened. So even while we have good services to prevent overdose deaths, we're still losing far too many people to a preventable cause. And that's where cannabis comes in. In 2016, at the BC Centre on Substance Use, some of us saw this preliminary data that I'll show and got really interested in this idea. Maybe cannabis might play a beneficial role in the overdose crisis. And one of those pieces of evidence, as Dr. Walsh suggested, was from the United States, comparing states that had a medical or recreational cannabis system to states that didn't. And lo and behold, what did we find? States with medical cannabis, less opioid prescriptions, less opioid doses or dispensations, less hospitalizations resulting from opioids, and less opioid-related mortality. 25% lower rates of opioid death, overdose, in states with a medical cannabis system. Now, this is not conclusive evidence, but it certainly excited us back in 2016, and it led us to really think carefully about how we wanted to investigate this issue. We're very lucky at the BCCSU to have some very large studies of folks who use drugs, and so we can learn very quickly and very effectively from them about the causes of drug consequences and what we might do to prevent them. So what we started to do was really ask questions of our participants, folks who use drugs, people who use drugs, about how they use cannabis, how they think we could integrate cannabis into treatment settings, how we could change the rules around cannabis and substance use to increase its possible benefits. So what I'm going to do now is show you some of that research and show you what we've learned from those studies. And they come from 3 studies, which include 3,000 people that we interview every 6 months. These are folks who are at highest risk of overdose. They're using drugs often in very risky ways. They're injecting drugs. They're using drugs in public. They're using fentanyl every day. And from these studies, we've really learned important things about the benefits of overdose prevention, the benefits of methadone, and the important roles that pain and trauma, stigma play in generating the harms that many of these people experience. So what did we learn about cannabis? The first thing is, no surprise, lots of folks at high risk of overdose are using cannabis. We estimate in our studies in the downtown east side about 2/3 of folks use it at least once every 6 months, and a lot of those folks are using it every day, often smoking joints. And why are they using it? Well, as Dr. Walsh has already showed, a lot of folks are using it for therapeutic reasons. While intoxication is still the most common reason people tell us they're using cannabis, we've also seen that 3/4 of cannabis users have at least one therapeutic reason. And as Zach said, they're dealing with pain. They're trying to improve their sleep. They're addressing mental health concerns like depression and or anxiety, for which there really aren't very good treatments, like benzodiazepines. And really exciting, we also found that they're using it for harm reduction. Some folks are intentionally using cannabis instead of the risky toxic substances from the drug supply. Not only for opioids, but also for stimulants and methamphetamine, which is really exciting because while we have some medications for folks who have opioid addiction, we don't have similar medications for folks who are living with a stimulant use disorder. And we found that many of them told us what an important role cannabis played in their life. This was a great quote from a younger drug user who used to be homeless, who told us, pot is major harm reduction for me. I come home from work, I buy the things I need for my place, I get high and enjoy the high for 3 or 4 hours, and then I go to sleep, you know? It actually works. It keeps me away from the crack. And that idea that people are using cannabis to deal with their crack use, to try and cut down on their crack use, addicted or not, is such a powerful thing and has really inspired a lot of us to try and figure out ways so that we can support these behaviors and help people survive the overdose crisis. Lo and behold, later on, we did a similar study, and we looked at individuals who were using using cannabis to address those cravings for stimulants, and we found if they did that, that preceded declines in stimulant use. That's not a conclusive finding, but it does suggest there are folks who are successfully using cannabis instead of crack cocaine. Similarly, we found folks who were using cannabis, periods of cannabis use were associated with lower rates of injecting drugs. And we all know, of course, about the gateway hypothesis. What we seemed to find was the reverse. Among younger drug users who had yet to start injecting drugs, if they were using cannabis every day, their rates of initiation of injection were far lower. So instead of cannabis inexorably leading to young people using heroin, and that's what the friendly Mountie in grade 8 gym class told me was going to happen if I used weed, little did he know I was a Grateful Dead fan. Instead of that, what we found was the reverse, that it seemed to be protecting individuals from moving from non-injection to injection, which is a tremendous step up in terms of the risk of not only overdose, but also acquisition of HIV and hepatitis C. We also found that pain plays an important role in these people's lives, and that some of the benefits of cannabis might be by serving as an alternate analgesic instead of the opioids of heroin and fentanyl in the drug supply. When we looked at the records from over 1,200 folks in our studies who were living with chronic pain, if they told us that they were using cannabis every day, they were far less likely to tell us that they were using opioids every day. Again, maybe evidence that they are substituting. And this is really exciting for the clinicians in the audience. You know, there's a lot of concern around cannabis interfering with methadone, interfering with drug treatment. But again, what we found was the reverse. When we looked at the records of our participants starting methadone, we found that those who were using cannabis every day when they started their methadone were far more likely to stay on methadone, which is a good thing, and they were far less likely to have evidence of fentanyl in their urine, which suggests that the treatment was working. This has really led us to suggest that cannabis might be a good adjunct for folks in methadone to make methadone work better. And this is the last big thing I want to show, and I'm showing it because it's not published yet, but it's probably the largest study of medical cannabis use in Canada ever conducted, involving almost 4,000 individuals and almost 40,000 interviews from 2005 until now. So all eras of the overdose crisis, before fentanyl and after fentanyl. I know there's a lot of numbers up there, and I don't want people to get bogged down in these terrible details, but I want to focus on this bit right here. So what we did is each of these lines is a different statistical analysis. And we paired different measurements of cannabis use. Folks are using cannabis every day. Folks have cannabis in their urine. And then these are the risk factors for opioid overdose. Having a non-fatal overdose, using opioids every day, having fentanyl in your urine. And long story short, what we found is in every one of these models, cannabis predicted lower risks of overdose death. And in fact, for the first time, we're seeing that cannabis use, both daily cannabis use and having cannabis THC in your urine, predicts lower risks of having a non-fatal overdose. Having a non-fatal overdose is one of the most potent risk factors for going on to have a fatal overdose. And for those of folks who have survived one, they know that it can often lead to brain impairment, behavioral issues, and it's a very serious medical event in and of itself. So I think this is very exciting work that we're hoping to publish soon and move forward. The last thing I want to say that we've learned is that access to cannabis, medical, legal cannabis in this group, in this population, is very poor. Legal cannabis has really yet to come to the downtown east side. It's more expensive than non-legal cannabis. You have to jump through a lot more hoops to get it. And if you're a homeless person using drugs on the street, you probably don't have a credit card and a mailing address to get medical cannabis sent to your address. So this is another really important point I want to make, is that not only is medical cannabis beneficial, but we also have to figure out ways to deliver it to people where they are, where they're at. And that's why I'm so excited to be a part of the Maverick program, to figure out ways where we can engage folks on their recovery journey with legal, safe, dependable, dosed cannabis. So before I conclude, and I'm wrapping up because Michael's getting the big hook, I want to just make two really important points about the limitations of this work. You've probably heard that saying that it's not correlation, it's correlation, not causation. I hate that statement for various reasons, but it is true here. We can't conclude from what I've shown you that there's a cause and effect relationship here. Maybe there is, but we can't exclude the possibility that other things are going on. To do that, we need to have a clinical trial, and that's one of the things we're working on. The other is that we're really not sure how this is working. And so that's why I'm always really excited to learn from folks on their recovery journey, to learn how they're using cannabis and what role it's playing in that journey. Because that's such an important missing piece of the work that we're doing, is figuring out how to do it. Because that means when we figure out how it's done, we can take it to other people and we can help them in their journeys towards lower overdose risk. And, we have some suspicions. We know that there are folks who are intentionally using cannabis to substitute for other more risky substances, classic harm reduction, as Dr. Walsh has suggested. We know that pain is an important thing, and not only physical pain, chronic pain, but psychological pain. 90% of the folks in our studies have had some traumatic experience as a child. Physical abuse, physical neglect, sexual abuse. 90%. So it's really no surprise that they are living lives so challenging now. And I want to also have a quote from, I think, a fellow we're going to hear from in a bit from the Maverick program. And he said, talking about his cannabis use, it's to create that stability and recovery, it was a complete game changer, talking about what cannabis meant for him on the CBC. And for me, that was such an eloquent way of talking about it. And it really, for me, opened up this idea that maybe that's what it's about, right? Maybe that's why folks on methadone do better when they're using cannabis, because the cannabis provides that stability, so that the methadone can do its work, and so that the individual can do their work, rebuilding social contacts, getting a job, getting a decent place to live, all the really crucial parts of recovery past the clinical interventions. So what next? Well, I'm really excited to say we're doing a clinical trial after much effort, as Dr. Walsh and any clinician involved in that sort of research will tell you. It's the first time, we think, that legal THC has been administered as a possible treatment for addiction. So we're very excited by that. We're doing it at the St. Paul's among volunteers who are on methadone. And in a sort of a medium term, we want to establish a service in the downtown east side, not only for folks who are living with addiction, but everyone who is using cannabis for harm reduction. It is unacceptable to me that we have warehouses across this country with hundreds of thousands of kilograms of unsold cannabis, and yet there are people out in the downtown east side right now using fentanyl because it's easier and cheaper to get a hold of. That's wrong. That's what we need to change. And that's one of the reasons why I'm so excited to be working with these folks who are trying to figure out how to bring the promise of legal cannabis, legal medical cannabis, to more people. So I want to conclude just by saying, well, thank you, first of all, for the time that we're spending together. The studies, I'm really happy to share the studies with you, and I hope you've gained something from that. We're still learning. We're still investigating. We have a pretty good sense, though, that at least for some folks at highest risk of overdose, cannabis is an important life-saving intervention. And even though we're going to need to continue the work to prove things to a medical or clinical certainty, we have the evidence we need right now to engage more folks in medical cannabis, especially the folks who are already using it right now, because the promise is there and certainly the need is now. And so I'm very thrilled to be here to share this information and to be with you all when we learn more from the Maverick as we move towards a future without an overdose. And that's certainly what we're working for and what we all hope to see. So thank you very much. My email's there. Please bother me if you like. One thing, if you want any of the copies of any of the studies that I've referred to, more than happy to send you a free PDF if you just bother me. And certainly we'll have questions. And thank you again. That wasn't too long. Great. Yes.
You weren't going to bring the hook out, were you? You did great, MJ. Thank you.